What's really happening with ChatGPT Health and Claude for healthcare? The common story is that OpenAI and Anthropic made some big strategic decision to enter healthcare, that they saw a massive market opportunity and decided to go for it. But the reality is more complicated and honestly more interesting for anyone building products in this space. 230 million. That's how many people were already asking ChatGPT Health questions every single week. Not after they launched ChatGPT Health, but before. OpenAI didn't decide to enter healthcare. Healthcare users showed up and OpenAI had to respond. In this video, I want to share what's actually happening here and why it matters, whether you're building AI tools, running a healthcare company, or just trying to understand where this is all going. I'm going to cover three things. One, how consumer behavior is driving AI product development, why AI is becoming a thin layer over everything else, and what this means for healthcare point solutions and why it's an opportunity and not a threat. Here's the thing that jumped out to me when I looked at these announcements. January 7th, 2026. OpenAI announces ChatGPT Health. The headline number, 230 million weekly health queries, already happening before this product even existed. And there's more context here. 600,000 healthcare messages every week coming from underserved rural communities like where I'm living right now. 7 out of 10 health conversations happening outside of normal clinic hours. People weren't waiting for permission. They were already using ChatGPT as their personal health assistant. So OpenAI built a product because there were people already using it. 4 days later, on the 11th, Anthropic announces Claude for healthcare. Same pattern, enterprise tools, consumer tools, HIPAA-ready infrastructure. The response was so fast because companies were seeing the same user behavior in their data. But here's where it gets really interesting. This isn't just a healthcare story, it's a pattern. The day after Claude for healthcare, Anthropic announces something called Cowork. And the backstory on Cowork is the kicker. Anthropic has this tool called Claude Code. It's a terminal-based coding assistant built for developers, built for programming, and I have a lot of fun with it. But when they looked at what people were actually using it for, they found something surprising. Vacation research, building slide decks, cleaning up email, managing media files, expense reports from receipt photos, booking tickets, filing taxes, you can go on and on. VentureBeat reported it directly. The development of Cowork was inspired by observing that developers using Claude Code were frequently using it for a diverse range of non-coding labor. So Anthropic built Cowork, which is basically Claude Code for everyone without the command line. Now here's the pattern. Users show companies what to build. Companies formalize the behavior into a product. The product wasn't planned, it was discovered. And here's where it gets interesting for anyone building software. AI is becoming what I'd call an abstraction layer, a thin layer that sits between users and existing systems. Let me give you some real examples. Users don't open MyFitnessPal anymore. They ask ChatGPT about their fitness data. Users don't read their lab results directly. They ask Claude to explain them. Users don't navigate insurance portals. They ask AI to check their coverage. And here's the critical distinction. This isn't replacing those systems, it's wrapping them. The data still lives in MyFitnessPal. The lab results still come from Quest. The insurance info still lives in Aetna's system. But the interface, the way users access it, that's what's changing. Think about it like an operating system. Windows or Mac OS isn't Word or Excel or Chrome. It's the layer that lets you access all of them. That's what ChatGPT is becoming for information, and there's data backing this up. 42% of people say Google search is becoming less useful. 61% of Gen Z use AI tools instead of traditional search engines. I know I do. Healthcare traffic to traditional websites is declining, while AI health queries are exploding. The interface layer is shifting. Now, the part most builders miss, especially in healthcare, is that this isn't a threat. It's actually a massive opportunity. I know what the fear looks like. I hear it all the time. AI will replace our product. Users will go directly to ChatGPT instead of us. We'll all be disintermediated. Here's why that's wrong. First, become AI referral ready. Town Hall Ventures put out their 2026 predictions, and one of them was this: ChatGPT as the patient front door and referral engine. Conversational AI is becoming the default starting point for healthcare questions, and that means AI-mediated referrals are coming. The companies that win aren't the ones fighting ChatGPT, they're the ones that ChatGPT recommends. Build for the world where AI is the front door and your product's what's behind it. Second, use MCPs to become the data layer. MCP stands for Model Context Protocol. It's the emerging standard for connecting AI to external systems. Healthcare companies can expose their data services via an MCP, and examples are already happening. Seraph Health exposes their healthcare transparency data with an MCP. BeWell is providing the EHR infrastructure for ChatGPT Health. HealthX is aggregating medical records for Claude. You don't need to be the UI. You need to be the system of record that AI queries. Third, generic wrappers are dying. Specialized systems are winning. Here's a stat that surprised me. Enterprise AI adoption actually fell from 46% to 37% because generic AI tools don't solve real workflow problems. What's winning? Specialized systems embedded in real workflows. Your domain expertise plus AI integration equals a defensible position. The value is shifting upward to the inference and workflow layers. So if you're running a healthcare point solution, the question isn't how do I compete with ChatGPT? The question is how do I become the trusted data source that ChatGPT consults? So here's the shift. Consumer behavior drives product development. AI is becoming the thin layer over everything. And for point solutions, the opportunity is to become what AI queries, not to compete with the interface. The risk is assuming you can ignore this shift because you have domain expertise or regulatory moats. The companies that win will be the ones that build for a world where ChatGPT is the front door. If you want to go deeper on this, I've got a Substack post with all the research and sources, links in the description. And if you're building in this space and want to talk through what this means for your specific situation, drop a comment. I'm actually curious what you're seeing. Subscribe for more on AI tools and the shift that really matter for builders.